Hello, I'm Dr. Poovamma, Senior Consultant and Director of the Breast Unit at Cytecare Hospitals, Bangalore. Breast cancer has become the most common cancer in India today, overtaking cervical cancer. Breast cancer is considered a disease of the westernized population occurring in women in the urban setups. The incidence of breast cancer is rapidly increasing, though the incidence in India is way below that of the West. It is said that 1 in 8 or 1 in 9 women in the West, in the US or Canada, would develop breast cancer in their lifetime. In India, it is thought that about 1 in every 21 women will develop breast cancer in India. And these figures again vary depending on the region in India. It's obviously much lower in the rural areas, higher in the cities. Bangalore is considered one of the highest numbers for breast cancer. It is said that about 36 women for every lakh population of women will develop breast cancer. The figures for breast cancer vary from country to country, especially the mortality. It is said that for every 2 women diagnosed with breast cancer in India, one of them will die from breast cancer. And this is very different from the West. And this is predominantly because of the level of awareness about breast cancer in India. Most of our women are detected with stage 3 and stage 4 breast cancer, which is very different from the West, where they detect cancers in stage 1 and stage 2. So I think awareness is the key for treating breast cancer. Breast cancer in India is very different from breast cancer in the West. It is said that breast cancer in India occurs a decade earlier in women compared to the Western population. So if you look at the ICMR data for breast cancer, depending on the age distribution, nearly 48% of breast cancers in India occur in women less than 50 years of age. It is said that about 4% of breast cancers occur in women in their 20s, about 16% in their 30s, and about 24% in the women in their 40s. So if we start mammograms after 50, we are literally going to miss half the population of breast cancer, and this is the most women at their prime who are going to be diagnosed late because of lack of awareness. While treating breast cancer, there's been a paradigm shift in the way we treat it from, say, even 20 years back to today. We've moved away from removing the entire breast. We are talking about oncoplastic breast surgeries, where we conserve the breast using plastic surgery techniques to have a aesthetically pleasing breast for patients who have multiple tumors in the breast or requiring a mastectomy. We're talking about immediate reconstruction so that at least we can remove the psychological and the social issues related to removing the entire organ. Coming to the research and the newer drugs in treating breast cancer, we are talking about a personalized treatment where the treatment is individualized to the person depending on the molecular subtype of breast cancer. We have a lot of newer drugs coming in, targeted therapy, immunotherapy, CDK inhibitors like CDK4/6 inhibitors. The newer molecules are coming into the treatment of breast cancer, which is increasing the cure rates. So we're going to have a lot more women living with breast cancer, and I think what is important is we give them correct treatment at the right time so that they can go back into society and lead a normal, good life, and there should be no more stigma attached to breast cancer. It is something as simple as a diabetes or a hypertension. You finish treatment and you go back to normality. At Cytecare, we treat cancer with organ-based specific units for different types of tumors. We have a breast surgical breast unit, we have a gynecological unit, we have a head and neck unit, we have uro-oncology and a neurosurgery too. We have a particular tumor board that we follow every week, where we discuss every single patient with all the doctors from different specialities, including the surgical branches, the medical oncology, the radiation oncology, the radiologists, the pathologists, where every patient is discussed as to what is the best way we can take the treatment forward for the individual. And I think with multiple brains coming in, we get the right format of treatment for the individual, which is very important. The other thing which we also do in the breast cancer unit is we have a social group for our patients. We meet every once in 3 months where old patients interact with our newly diagnosed patients. And I think for the patients who've been newly diagnosed, there's a lot of strength which they derive from meeting other people who have gone through the same journey, and it gives them a lot of hope that they're going to be okay in few months down the line. Because with breast cancer, there's a lot of general appearance which changes with treatment. There's loss of hair, there's change in color, there's the change in skin. And I think when they see patients who have completely recovered from that and gone back and leading completely normal lives, working, having fun, it gives them a lot of encouragement and courage to go through this journey that is breast cancer. Many a times patients tell us, going through this cancer treatment is more of a mental trauma than a physical trauma. So I think having a group to support you is really helpful. And our group is a very vocal group who are always on WhatsApp and ready to support newly diagnosed patients. They're just a call away, and I think that's very nice for the patients to have. The treatment for breast cancer at Cytecare is completely protocol driven. We follow international guidelines from the NCCN for every stage of cancer and the subtype of the submolecular type. The entire treatment is protocol driven. It's not what I feel is best, but what is considered the best worldwide is followed for every patient. To increase the awareness of breast cancer, we at Cytecare have also started something new, different. We are working with Enable India, an NGO, and who are training visually challenged girls to do a physical breast examination. They come to us for internship. We allow them to talk to our patients and allow them to examine our patients. And they are taught how to palpate the breast clinically to identify what is normal, what looks abnormal, what needs further evaluation. So many a times preventive healthcare in India still is at its infancy, where the take of it is very low. How much ever we tell women that you come in for a mammogram after you're 40, at least once in a year you come in for a screening mammogram so that we can pick up tumors early, women do not come in. So these girls have been trained. We send them out into the community to do physical examination for women at their workplaces, at a club, or at your workplace itself. And these girls examine women and tell them if there's something wrong, and then they have been advised to come into the hospital. And then women do come in because they know, okay, there's something wrong which needs further evaluation. And they also create awareness about breast cancer by talking to different women, what are the symptoms of breast cancer, and how to examine your breast, what is important is to be breast aware. What does your breast look and feel like, and what is abnormal, and when do you come in to the hospital for a further evaluation.